Now he's going to move on and enjoy his life elsewhere. So, Dr. Madrid, you want to take the stage?
Thank you so much for that type of introduction. I think 20 years ago when we started to think about getting a healthcare provider, I could not imagine that 20 years later this organization stands on itself, because we did not have any endorsement, we did not have any sponsor, and the reason why we are here is because of the hard work of members and past president, Dr. Jalali, Dr. Janabzadeh, and all of the board members. And on top of that, I think that with the support of all of the members that supported this program. Also, I have to acknowledge the help and support of my wife, my lovely wife, Susan. Without her, it was not possible for me to get involved with all of these community activities, and she has been one of the persons who has made connection and link to other friends, and I can see a lot of familiar faces here. So it's an opportunity for thanking the board and also the members. As Dr. Janazadeh mentioned, our mission was to connect people that they are in healthcare, and we expanded between physicians and dentists and nurses and other health providers. So thank you for being here, and without your membership and without your activity of the board, without any expectation, would not be here. Now I have the pleasure to introduce our guest speakers. We have two of them. One is Dr. Gharib, and he does not need to have any introduction. Dr. Gharib is not only a friend, a colleague, but also a mentor, and he's an attending physician at Mayo Clinic. He's a past president of Endocrine, American Endocrine Association. He is a publisher of many books, and if I wanted to go through his CV, I would not be able to finish that even by the time that you are done with your food. I think Dr. Gharib has been kind enough to provide services to our community. Most of the faces that I can see, they are familiar with him and they benefited from his services. Anytime that a patient, either from here or from other states, they needing to get to Mayo Clinic to get help for complications or difficult problems that they could not get anywhere. As soon as I contacted Dr. Gharib, he was kind enough and he made arrangement, and even he asked this patient to contact him directly and contact him through his email. So I think his service, it is second to none, and Dr. Gharib's name and his contribution to endocrine, and especially thyroid, is basically is worldwide. And thyroid and Dr. Gharib are synonymous. So tonight I'm honored and it's my privilege to introduce Dr. Gharib to be our speaker, and he's going to talk about Shaw's malady or a disease, and his odyssey is a non-political and it is basically it is an educational program to have Dr. Gharib to give his lecture. After his lecture is done, we will have some about 5-10 minutes time for people to have a question before we get to the next presenter. Thank you.
Thank you. Thank you. Thank you very much. This is slide 4. Yeah, thank you. Thank you very much. Thank you very much. شب شما بخیر. Everybody, welcome. Thank you for coming to this occasion. There are a lot of faces here that I have to acknowledge before I start. I have my patients here. There are some of my patients, Nasreen and Brian Jewell, who have been my patients for 30 years. Dr. Mahjouri and Susan, his wife, have been friends with us for 30, 40 years. Good friends. My two sons are here, Asai PD. My two sons, Mahmoud and Muhammad, both live in Minneapolis. They are here, and Lenny Fenster, his father-in-law is here. Dr. Sinaki sitting here, she is a colleague of mine for 50 years at Mayo, now retired professor of physical medicine. And next to her is Hossein Khalili, Canadian from Iraq, Iran, Canada, and now US. A good friend in professor of telecommunications. Dr. Sanjabi is here. Dr. Sanjabi and I were both residents of Hawaii, whom I have known for 50 years. Very successful, very prominent businessman from Rochester, who has always had an open house for Iranians who come and need help. So I have many here. As an Irish philosopher whose name, and then in Farsi, Dr. Mahjouri asked me if I would come and give this talk. It is a pleasure to meet you, to be with you tonight. But which means I'm here primarily to see you rather than give this talk. So with that introduction, I'd like to start my talk, which is on Shah's illness. It is, as Dr. Mahjouri said, it is only a medical evaluation of Shah's illness and its intricacies. It is a very interesting topic that I have studied for years, and I will present a 35-minute presentation tonight. But before I go, I'd like to acknowledge Dr. Mahjouri for his service to the medical community here in the Twin Cities for 5 decades. So Dr. Mahjouri, thank you very much. Thank you very much. Round of applause. Father of 2, loving husband. So Dr. Mahjouri, good luck to you in your retirement as you start a new chapter in California. We hope that you come and visit this frozen tundra. And thank you, Mihan, for the invitation to come here tonight. So Shah's medical odyssey by definition, just that kind of a journey. So historical perspective, this is the Tsar, Russia, 1918. The Imperial Russian family, the Romanovs, were captured with the Bolsheviks. They were taken and brutally murdered, executed, all of them, including the young son who was 13 years old at the time, and in the 20th century, the second was Iran. The Pahlavis did not have as bad of an outcome as the Romanovs, but still their journey was nevertheless traumatic. So in 1979, Shah and his family and the royal group left Iran. Shah was, as we shall see, for a year and a half, a man without a country, himself a major tragedy. But in addition to his illness and exile, his family, 2 of his children subsequently died. His daughter committed suicide, his son committed suicide, and his daughter overdosed. So again, a tragic outcome for the Pahlavi family, who from the second revolution of the 20th century. Again, looking at the history of Iran, the Qajar dynasty ruled Iran for almost 150 years, and they were a number of corrupt dictators in Iran who held Iran back from modernization. And at the end, then Reza Shah came. Reza Shah was a powerful dictator, perhaps ruthless and corrupt, but nevertheless, he did a lot of good things to modernize Iran during 15 years of his reign in Iran, from 1925 to 1941. Now, one of the tragedies, and this is mostly for American colleagues or those Iranians who do not know, like my children. One of the tragedies is that in 1941, Iran had declared its neutrality in the international community. But nevertheless, Iran was occupied by British and Russian armies, and Reza Shah had to abdicate because of that. Now, true, Reza Shah may not have been a popular. Most Iranians would not have liked to see foreign pressure to abdicate. At any rate, he left Iran and in exile and died. He was the person who changed Iran's name from Persia to Iran. His son was Muhammad Reza Shah Pahlavi. You can see the picture here of the early ones. Here, he is a timid, pleasant, democratic young man who then becomes, in the 1950s, more autocratic and eventually becomes Aryameh and King of Kings and the Shah and so forth. So there was a transition in the 35 years of his reign from a rather young democratic person to a dictator at the end. Now, this is the end of the monarchy in Iran. So 1979 revolution, Islamic revolution, ends the Iranian monarchy. Shah leaves Iran, and the changes are coming. And these are some newspapers from that time. Shah's Odyssey, it started on January 16, 1979, when he left Iran. He had no place to go. It was only Anwar Sadat's invitation that allowed him to go to Egypt. So he stopped in Egypt, and King Hassan of Morocco was the next person who invited him to stay. Then from Morocco, he goes to Bahamas for 3 months, and then he is forced out to leave Bahamas and seek asylum somewhere else. So he ends up in Mexico. And in Mexico, his illness gets worse, and he has to seek medical attention, and he ends up in New York. We will cover some of these in more detail in subsequent slides. He ends up in New York, gets treatment, then has to leave, and he eventually ends in Egypt again, and he dies a year and a half later after departure from Iran on July 27, 1980. So this is his odyssey, a year and a half in exile, ill, pressure, and fear for his life. So these are pictures taken when he was leaving Iran and then when he arrived in Egypt. Following his exile, he had no place to decline, and many other countries, even Jordan, the king of Jordan, King Hussein met his wife in Iran because of Shah and Faraz when they invited him to meet but even Jordan, because of the political changes that were happening in Iran and the Middle East. And so Shah's illness, when did it start? It began several years before the Iranian Revolution. It was a tightly held secret. No one outside Shah, and as you shall see, a few people knew that he was ill. Ultimately, a number of medical teams participated in the treatment. Some of the differences in opinion regarding his care could be attributed to differences of approach to medical practice. But some of it certainly was tainted with political and malpractice issues. And so Shah himself in 1973 1973, while vacationing in Kish, found an enlarged mass in his upper abdomen on the left side. And he goes to see Professor Fellinger. Professor Fellinger was a famous physician in Austria who cared for monarchs, presidents, and the wealthy. He goes to see Fellinger, whom he had seen on many other occasions, and Fellinger confirms that his spleen is enlarged and says that this is likely due to an old malaria infection, and tells him to seek more attention. So this thing started in 1973. When he returns to Tehran, he asked Asadullah Alam, his confidant and his good friend, and asked him to help him evaluate and treat this problem. The Shah knew, he was a smart man. He knew that there was something seriously wrong. And so Alam, actually in his memoirs, does mention some of the discussions, etc. But Alam, interesting is that Alam himself was about the same age as the Shah, and about the same time was being treated for lymphoma, which the Shah had. It's curious, the two of them had the same disease. There are some who have said that maybe Shah and Alam had AIDS, and maybe they were gay. Well, that is not true, and in social media. Died of his disease a year before the revolution and was buried in Mashhad, his birthplace. But he then asked the French doctors to come, who had helped Alam himself, to come evaluate the Shah and treat him. Alam asked Dr. Abbas Safavian, whom I know very well, and I met him many times in my trips to France. He died just 3-4 years ago. Dr. Safavian was Alam's Bajanab. He was, the wives were related. But in addition, Al-Safavian was French trained, had a lot of friends in France. Alam asked if he could assemble a team, and so Safavian then steps forward, and then he manages Shah's care secretly behind the scenes. He invites, he asks General Ayadi. General Ayadi was Shah's personal physician, a very powerful man in Iran before revolution. He asked Ayadi to help him, and the French team begins to come to Iran and to treat the Shah. The French team is Professor Millier, who is a famous internal medicine physician, and Professor Bernard, who has a syndrome named after him. He's a hematologist, well-known hematologist. And then Professor Flandrin, who was a laboratory hematologist specialist. The three, especially Bernard and Flandrin participated in care. They would fly Sunday afternoons with Air France from Paris to Tehran. They would get picked up at the airport, go near the Niavaran Palace, and they would visit the Shah once a month, Monday a.m. to noon. They would do the tests, and they take the slides with them, go back to Paris, and then look at the slides and advise the Shah what to do next. So they would be in Iran for 24 hours, and this continued on for 5 years. Nobody knew these people came and left. So Dr. Bernard and Flandrin then make a diagnosis at the time that this is chronic lymphocytic leukemia, and the spleen, enlarged spleen, is because of leukemia. And so they start chemotherapy for Shah. They do not tell him what he has. They tell him you have malaria. The medication, the drug is anti-malaria from Quinistril, it was bottled in France and sent to Iran with the name anti-malaria drug. But it was given to Shah without his knowledge of knowing that he has cancer. They did not inform him, and he did not ask. So that was the treatment between 1974 and 1979 when he left Iran. In one of the trips that the Shah had in 1976, he goes from Tehran to Kerman, and Purshuja was his adjutant. I met Mr. Purshuja some years ago in Iran. Very nice man. He was Shah's private executive secretary. They go to Kerman, and Shah tells Purshuja, I don't have any more of my drugs. What should we do? He says, no problem. He takes the bottle, anti-malaria, goes to the pharmacy, and the pharmacist says, here you are. So the Shah took the anti-malaria medication for a whole month, and not knowing that this is the wrong drug. So then when Flandrin and Bernard come to Tehran, examine him, they see that spleen is enlarged and his blood counts are worse. So they look at the medication and they find out that there was a mistake made for a whole month. This man was taking the wrong drug. So secretive approach has its own drawbacks, and this was one of them. In 1977, 3 years after his diagnosis and 3 years after the initial spleen enlargement, Farah is informed that your husband has this leukemia, which is unusual. I mean, you know, if somebody is sick, you tell him, and you tell his wife, and you tell his family, and get everybody involved. But that was the case. And so people who knew initially and were involved in Shah's care, of course, the first one was Alam, who was Minister of Court, Royal Court, and good friend of Ayadi, who was personal friend and very good personal physician and very good friend. Bernard and Flandrin and Milez, who were the three French, the team who came to Iran. Safavian, who died just a few years ago, he was involved with the whole arrangements behind the scene. And Shah himself, of course, he knew that he had illness. He was a smart man, but he did not know that he had cancer until 1979. And so Farah was told in 1977, but she, in her memoirs, notes that in 1973, Shah had said something that made her suspect that there was something wrong with him. He had said that if something happens to me, you should take care of and control the government. And with that, she perhaps concluded that there was something not right because of what he had said, but there was no direct information. The American connection was that there were many people from the US, many leaders, many famous people who were involved in Shah's care. Of course, the first is President Carter, who is still alive at age beyond 100. The others were Henry Kissinger, David Rockefeller, Dobeki, the famous physician, Benjamin Keane, whom we shall discuss, Dr. Morton Coleman, who was an oncologist at New York Hospital, and Dr. Thor Yarson, who was a surgeon. So these were the medical people who, or political figures who were involved in Shah's care during his treatment he went from Iran. First stop was in Egypt, in Aswan, where he rested. And then from there, he went to Morocco, and he wanted to travel elsewhere, but doors were closed. No other country would accept the Shah to come to visit or to stay. Eventually, he gets permission to go to Bahamas, where he stays 10 weeks. And at that time, he begins to feel sick. He has fever, he has jaundice, he's not feeling well, losing weight, and obviously something sinister was happening. So he goes to Mexico, and in Mexico he has a team of local physicians who take care of him. But at the same time, Shah insists that some American team should come to visit him. State Department sends Dr. Benjamin Keane, which is one of the ironies of this whole saga. Dr. Benjamin Keane was a famous tropical medicine physician who practiced in New York, who had written a book on tropical medicine, had no knowledge of medical illnesses that the Shah had. And he was asked to go and see the Shah, despite the fact that he lacked the expertise to evaluate the situation. Keane was a nice man, a gentle person, a caring physician, who then sees the Shah and insists that he should go to New York for further care. Despite the fact that Mexican physicians discussed and said that we have all the equipment, everything they need, and they have in New York. So despite that recommendation, Keane insisted, and Carter listened, and behind the scenes, Kissinger and David Rockefeller pressed Carter and the White House to admit Shah for treatment to US. So the Shah then goes from Mexico to New York on October 22nd. He is admitted to New York Hospital on the name David Newsom. It just happens that David Newsom was the Assistant Secretary of State, and he was pissed off when he learned that Shah was under his name admitted to the hospital. I mean, of all the names they could have picked, they picked up a leader in political Washington. At any rate, he was admitted to the hospital quietly, secretly, but the next day, news was out. They had a news conference, press conference, and they announced that the Shah of Iran is admitted. So New York Hospital, he gets an evaluation there. Dr. Coleman, that I mentioned earlier, was an oncologist who sees the Shah and says that his spleen is enlarged. This is part of the problem, and he should have his spleen out. But nobody listened to him. So when the Shah is in the hospital, he has fever, he has jaundice, and the assumption is that he has gallbladder cholecystitis, gallbladder and gallstones, and therefore he needs surgery, and Dr. Boyerson operates on him and takes out his gallbladder and the stones, but in the duct, in the gallbladder duct, there is a stone that is left behind. One other problem with mismanagement of this case. And at the same time, when the operation is going, Dr. Coleman learns that splenectomy was not performed, and so he gets very upset and reprimands the medical team. Why did you not do the splenectomy while this patient was in the hospital and in the OR? So after the splenectomy, after he stone, get a famous physician from Vancouver to come and take out the stone with special equipment at the time in the 80s. The Shah is recovering. The diagnosis is lymphoma at this time, and they recommend that he get radiation therapy. New York Hospital does not have a radiation team, and so it is recommended to go across the street to Sloan Kettering Memorial Cancer Center for radiation. Sloan Kettering declines Shah's treatment. Now, to backtrack for a minute, his mother, Queen Mother, as they called her, 5 years earlier had been diagnosed with lymphoma. Soon after Shah himself was diagnosed with lymphoma. He does not allow his mother to go to France, so he refers his mother to New York, to Sloan Kettering for treatment. She goes there, they confirm that she has lymphoma, and they treat her, and she was so happy with the treatment that she donates $1 million from Pahlavi Foundation to Mrs. Sloan Kettering. But despite this, they do not accept Shah as a patient. So then White House puts pressure on the Sloan Kettering, and they accept, and Shah's treatment is after midnight, every night for several weeks, for treatment for radiation for his lymphoma. So at this time now, we are getting close to the time when in Iran, revolution and the hostage crisis. So Shah is admitted to the hospital to the US on October 22. And then the US Embassy in Tehran increases security once it is occupied by students, but then they are expelled. But the second time they go and they occupy the embassy on November 4, and they take a number of hostages, 66 hostages. A number of, several were black, several were women, they were released. Eventually 52 hostages were kept for 1 year. And you know the story of what happened and the hostage crisis in 1980. So this is the picture of the Shah while he was there. This is the picture of the embassy. The embassy is now open. They call it the Den of Spies. I went there and I have some pictures. It looks just like this, except it's occupied by Iranian military forces. This is the occupation of the embassy. Hostages who were paraded on television, and Americans saw this, and there was a huge uproar here. And of course, Ted Koppel started his evening news program because of the crisis. For some of you may remember that there was no evening news at 10 o'clock. Every night at 10 our time and 11 New York time, there was this news analysis report from Iran of what is happening to the hostages. So it was a big issue. Well, so the pressure builds up after the hostage crisis to have Shah leave US. First, Shah is pushed out from New York to Lackland Air Force Base, where he is kept in a dormitory for soldiers, and Farah describes this as like a prison in her memoirs. So he stays there a few days, and then from there he is moved to Panama. He's forced actually to leave the country because they thought maybe if Shah leaves that the hostage crisis would subside. So he leaves, goes to Panama, and at that time Torrijos was the Panamanian chief and dictator, the corrupt man who eventually was pushed out himself. In Panama, again, Shah is not feeling well. His spleen is enlarged, he has symptoms, and the question is what to do for the Shah, for his spleen, and whether or not we can treat him in Panama. Dr. Dubaiki is asked to come. Shah insists that a famous Dubaiki who has nothing to do with spleen to come. Dr. Dubaiki is a cardiovascular surgeon. That's one of the other areas of sources of error, because Dubaiki is famous. The Shah and the royal family insisted that he should come. I agree what to do and where to do it and how to do it. So Dubaiki leaves, everybody is upset, and Shah is afraid at the time that Iran is behind the scenes, is talking to the Panamanian government for expedition of Shah to Iran. In fact, there were some talks, so Shah says we have to leave, and therefore he leaves at that time hastily with an airplane that was chartered by the White House, $200,000 chartered, but the Shah and the Iranian family, the royal family, had to pay later all the money for this. So it was no compliment. So Shah goes from here to Egypt, and in Egypt at Al-Mahdi Hospital, again, Dubaiki shows up, and he is now ready to do the surgery, which is probably too little, too late. The spleen is removed, it's almost 10 to 15 times normal size, almost 2 kilos. A normal pancreas is, the spleen is somewhere around less than 200 milligrams. And so the huge spleen is removed, and after fever, abdominal pain, and the physicians, even Egyptian physicians, suggest that this could be an abscess from surgery. Dubaiki says it is not, and he decides that he will leave and leave the patient behind. They call another French surgeon to come, and indeed there was a huge abscess. 1.5 liters of pus was removed from the stomach, likely improved. So this is the time when the Shah gets chemotherapy. He gradually goes downhill from this point until he dies on July 20, several weeks later on July 22, and Anwar Sadat offers him a state funeral. A few dignitaries, including past President Nixon, attended the funeral, and he was buried at Al-Rifai Mosque. Has anybody visited Al-Rifai Mosque? I have. It's a small place. The Shah and his father both next to each other, placed in the mosque. So that was the end of Shah's odyssey. So let's take a look and see what else is happening. And Shah's death was not recorded or reported or much reacted, but there was not much. And in fact, that's what the official news Iran agency on the radio and television announced, that the Shah died, and he died like a pharaoh of Egypt. Shah's many diagnoses included, one was the enlarged spleen or splenomegaly. Initially, chronic lymphocytic leukemia was diagnosed because of his blood counts. Eventually, this evolved into Waldenstrom's macroglobulinemia, which is a progressive dysproteinemia and malignant lymphoma. And then Richter syndrome is the fulminant aggressive behavior of chronic lymphocytic leukemia towards the end. So these were his diagnoses, and eventually he had an abscess from surgical treatment and splenectomy. So how much did the Shah himself know about his disease? It seems clear that until 79 or 78, he did not know that he had a serious disease. Although you would think that Shah was a smart person, he probably would have guessed that there was something serious wrong, that it was not malaria, but officially, he was never told that he has cancer. Flandrin, the French laboratory physician, has said that I told the Shah that he had Waldenström macroglobulinemia, a point that Dr. Safavian denies, and he says that if he had told the Shah was smart, would have done some research and find out that he had this disease. So there is some discrepancy between he said and he said, who said the right thing. So we don't really know. The secrecy and disagreements also had probably a negative net result on the patient. So this is the queen got sick. The Shah did not want her to know that he would be excluded from the care that he received. So he sent her to New York. Dr. Ben Keane was not an appropriate physician, an experienced person to come and evaluate the Shah's illness in Mexico, yet he was the person that State Department nominated. At New York Hospital, Dr. Coleman was very upset because he wanted splenectomy, which was not done. And this was obviously against. In Egypt, French team disagreed on many issues, including the subphrenic abscess that developed. So mistakes in his medical care, none was that one that said splenectomy, splenomegaly was initially felt due to malaria, but it was not. It was because of his hematologic disorder. That accurate staging of lymphoma was never done, and perhaps would have been helpful, and appropriate treatment might have been started. Cholecystectomy, New York Hospital, even with expert surgeon, missed a stone and had complications. Eventually, spleen was removed in Cairo, but maybe it was too little, too late. And during splenectomy, pancreas was injured and there was abscess, and post-op abscess was not appropriately diagnosed in time. It took a number of days before it was diagnosed and effectively treated. So during a number of teams were involved in his. He was Shah's personal physician and supervised the team. Flandrin came from Paris to Tehran on many occasions. According to himself, 35 times he came to Tehran during the 4 years for treatment of the Shah. Akin was the person who treated and advised Shah for his illness during the time in Mexico and then in New York. 8 separate teams were involved in his care. And again, this agreement may have been somewhat justified just based on medical grounds. So Dr. Safavian has a YouTube video, and if any of you wants to listen, you can listen to what he says. He has been interviewed for several hours, and he explains his disagreements with what others have said. And he was intimately involved with Shah's care. I know him. He was an honest man, but he had his own ideas. When I talked to him about could be treated with chemotherapy and not know his diagnosis, he said, well, this is the Shah is the #1 person in Iran, and there are political implications, and there are all kinds of implications for international affairs. You just can't tell the Shah that he has cancer, and therefore we did not tell him. And then I asked him, I said, but how do you treat someone with chemotherapy without his knowledge or his wife? He said, well, you just have to step up and overlook some rules and regulations. So that was his belief, and if you are interested, you can watch him. Unfortunately, he is gone. Now, in developing this in research and in this thing, I came across the Belmont report, and some of you may not know the Belmont report. So for those of us who now do medical research and we talk to our patients, there are certain patients and ethical concerns. If I see you as a patient, I tell you you have leukemia, I can't tell your wife that unless you give me that permission. And I can't tell your brother who calls me that you have this diagnosis. And then if I treat you, I have to inform you of the treatment. This all was not present until 1979. So, ironically, about the same time that Shah was getting treatment. So the Belmont report came to be because of the talk about that study, because that is a dark, shameful period of American medical treatment. So Tuskegee is a place in Alabama. In 1932, the U.S. Public Health Service and the CDC, they start a study, what is the natural history of syphilis and how does it progress? So it's called the Tuskegee syphilis study. None of the patients knew that they had syphilis, and none of them were treated. Even between 1932 and 1947, there was no specific treatment. But then when penicillin came, nobody was told and nobody was treated. In a huge uproar, many of these patients had died of syphilis without being told or treated. So it was really a shameful thing so as a result of the Tuskegee study, then the Belmont report came to be. And the Belmont report then is the report that nowadays, if I have a patient, I have to tell the patient that there is a minimal risk for this, that I have to treat subjects fairly, that when you study a patient, you need informed consent, and oftentimes that has to be a written consent, and then first do no harm and maximize benefits. So the Belmont report came as a result of a Tuskegee study, and it is also touches on Shaw's illness as well, because he was not told of his illness, his family was not told, he never had special counseling, and so forth. So you wonder if things would have been different. So the political mistakes that would happen in the US on this side, number one is that Carter was forced to admit the Shah, and then, of course, the consequences were that he lost the presidency because of the decision that the Shah came, the hostage crisis, and the fiasco that followed. And then Dr. King, to whom I respect immensely as a respected physician, he was not an appropriate person to come and treat someone who has jaundice, who has lymphoma, and who has a hematologic disorder. There could have been a number of other experts that could have offered sound opinion regarding Shah. And then the consequences for Iran, also this secret management was huge. For example, you could say, well, maybe if the Shah had known that he had a fatal serious disease in 1973 or 74, he might have made appropriate measures for succession and so forth. And maybe things would not have come to the Iranian Revolution. Who knows? And also then there would have been other issues as well for Iran with regard to what happened in the subsequent hostage crisis and all the problems that developed afterwards. So a number of colleagues have looked at Shah's illness, and I will offer you only just a few of them here. Dr. Cervantes, who was a professor of surgery in Panama, in Mexico City, he said that the whole thing was a book of malpractice. And this is only at the time when the Shah came and went to Mexico, not the subsequent part of it, which was another year. Who was a famous oncologist at New York Hospital said that books boiling the broth. That was the problem. There were too many people who were telling what to do, what not to do. Two brothers, one physician, Khoshnood, they looked at the picture of Shah's history and illness. And this is what they came with. The Shah's care was infected with political interference, medical misdiagnosis, careerism, confusions, and conflicts. Shah's death was also one of the most shameful debacles of history of medicine. Strong words. And then finally, Dr. Morgenson, who was a senior American surgeon who studied Shah's illness, in an article called Shah's Spleen, this is what he concluded. There were too many doctors involved in a complicated case that demanded meticulous and delicate management. The Shah was denied this. It was not a proud moment in world history, medical history, or the history of surgery. So it looks like impartial observers who have reviewed Shah's care have come to the same conclusion that he received poor care. And these are my own takes from the research that I did, that despite his position and prestige, or possibly because of it, the Shah did not receive optimal medical care, with many mistakes by his multiple medical teams. That there still remains many unanswered questions: why this happened, why not, and could he have received care in Mexico City? Maybe things would have changed. In the end, strict secrecy may have caused more harm than good, even for Shah himself not to know the disease, and for his family, and for Iran as a country. It may have had a better outcome. We don't know. Shah's own decision at times was not sound. For example, he asked and insisted that Dr. Dubeki come to treat him, and that probably was not the best care that he received. But he didn't know, and of course we are looking back at history. And I have serious concerns about medical and ethical aspects, even though Professor Safavian tells me that he is convinced that they did the right decision in 1978 and 79. To me, I am not convinced that he should not have been told and that his family should have been informed of this. And again, this case illustrates that the famous and celebrities may not necessarily receive best medical care despite their money, their fame, and their fortune in Isfahan. Thank you very much.
Thank you so much with all of the detailed information you provided and the result of your research. I was wondering if there is any question from the audience, so we'll spend a few minutes to address them. Anybody has any question? Jay?
Dr. Gharib, thank you very much. I've never seen a presentation like this. That was mine since I'm sure you've read some articles about conspiracy theories. Is there any medical possibility that the Shah's problems would have started either with prolonged poisoning or radiation or some other malevolent, technique?
Thank you very much. I don't think so. If anybody is interested, there is a book, The Shah's Last Ride, by William Shaw. It's a book about his last 2 years and his illness. And he has 400 pages of research and a lot of references. To answer your question, no, I don't think so. But then I'm not an expert on behind the scene things. I could only get things that were published and available online.
And nobody else has a question. Friend that you're dealing with. So Dr. Imami, he is a plastic surgeon, an outstanding plastic surgeon in Iran. I his information and helping me to get to Iran and then participate in providing some care to our Iranian friends. He is an outstanding plastic surgeon, and he is the first plastic surgeon in Iran who had fellowship in craniofacial surgery by Dr. Tessier, the famous plastic surgeon from France. Dr. Imami is going to talk in Persian, and at the end, Dr. Janabzadeh is going to just give a summary of what he's talking about. It's about the pressure and update about what's going on in Iran for people who are trying to help others. Dr. Imami.
و درود خدمت هموطنان عزیز، خانم ها، آقایان. خیلی خوشحال هستم که برای اولین بار در یک همچین مجمعی که جناب آقای دکتر مهجوری به من اطلاع دادن و این فرصت را به من دادن که در خدمت شما باشم بسیار خوشحالم. متاسفانه من از موقعیت این کانون و نحوه پرزنت کردن مطالبم اطلاع نداشتم که به چه فرم باید اینو ارائه بدم و مثل جناب آقای دکتر غریب اطلاع نداشتم که به چه فرم باید اینو ارائه بدم و مثل جناب